Ruth Katz here, Aspen Institute Vice President and Executive Director of the Institute's Health, Medicine, and Society program. I also serve as Director of Aspen Ideas Health, the 3-day opening event of the 10-day Aspen Ideas Festival. Now in its 13th year, Aspen Ideas Health brings together visionary health leaders and bold innovators to discuss today's most critical health challenges. And we're especially proud of our connection to Aspen Valley Hospital, which has a new CEO, Dr. Richard Becker. I'm delighted to be in conversation with Richard today to share more about him, his vision, his priorities, his plans for the hospital, and to talk about how his plans and his goals and our agenda for Aspen Ideas Health share so much in common. So Richard, welcome to Aspen. Welcome to the hospital. Welcome to the Valley. Welcome to Aspen Ideas Health. We're just so excited to have you here.
Thanks so much, Ruth, and appreciate the kind words and the introduction. I'm thrilled to be here, thrilled to be in Aspen. We've been coming as a family to Aspen for 20 years and just love and enjoy the community. And so it was always a dream to live and work here and really have an impact.
All right, let me turn to some of your priorities, which I think match up very nicely with some of the work that we're going to be doing as part of Aspen Ideas Health. I know you're still relatively new, so your plans are not all fixed in place, but I believe you already have identified some top priorities. And as I said, many of those, I think, many of those also are the focus of some of our programming in Aspen Ideas Health. So I want to explore just a few of them. And let me start with longevity. For example, I believe I've got this right, that the hospital has recently launched a longevity and wellness program. Tell us a little bit about that. How's it operating? What are the goals? What's your target population? That sort of thing. Because obviously, I would think that's a huge interest to the folks in the Valley.
No, that's exactly right. So we're very focused on wellness and longevity. And I think that, to take a step back, everyone's talking about wellness and longevity. Everyone's writing about it and, everyone's engaging in it. And so I think the challenge for any community, and this is particularly true in Aspen, is to define what it means for each cohort or each group of people, right? So for the Uber athletes and the folks who are very focused and have access to just about anything, wellness and longevity means, one set of things, right? And that is, what are the latest and greatest, dietary, training regimens. If I'm interested in supplements or peptides, what's the science behind that? How can I access that? And then, what's the relative, risk benefit or value proposition for actually engaging that? There is some science out there about that, as we know. There needs to be probably a lot more science out there around this. But then when you kind of take off that hat and put on the hat, that's more of a public health hat, one that you are, obviously a great leader in, but one that I've also been focused on and think about as I've been in more vulnerable communities. What does wellness and longevity mean in that community? So Aspen proper, and here that translates into Aspen proper, and then the Roaring Fork Valley, where there's much more uniformity in the town of Aspen, 6,000 or 7,000 people, much more diversity, economic diversity, ethnic diversity, demographic diversity, and health diversity, honestly, throughout the Roaring Fork Valley, where the population is 45,000 folks or so. So applying that and really addressing both, because we don't want to leave anyone out. We want to address all of these things. And if there are, some scientifically based supplements or things that can complement care, our goal is for everyone to have access to that. If there's, evidence that one or more therapies can help you live longer and help your quality of life as well.
Aspen Ideas Health actually has an entire set of sessions this year centered on the theme of longevity. We call it our Vitality Lab theme. There, we're going to discuss the differences between lifespan, how long you live, and health span. How healthy are you while you are living as long as you possibly can? And explore, as you've just discussed, new and different ways in how to extend the healthy years of our lives. We've got a session featuring both the director of what's known, it's a government agency, ARPA-H, as well as the leader of XPRIZE HealthSpan. That's a private enterprise. Both of these organizations are organizations that focus on, if you will, moonshot kind of stuff. What's really out there in the future that can help to revolutionize healthy aging. We've also got a well-known author and bioethicist. I'm sure you will recognize his name, Dr. Zeke Emanuel. He's speaking about his new book, Eat Your Ice Cream. And
yeah.
As far as I'm concerned, if that's part of living longer and better, I'm all for it.
I'm all in.
But that book covers his 6 rules for living a long and healthy life. So what you're doing, what we're doing. Let me then turn to the issue of rural health, which also seems to be getting a lot of attention these days. The big, beautiful bill that was passed by Congress and signed by the president last year, as you know, includes significant support for rural health needs, including those for rural needs that rural health hospitals like yours are currently confronting. That is those hospitals that provide care to people just like those living in the Roaring Fork Valley. Aspen Ideas Health is, and I want to come to what you're doing in this area, but let me just mention here that we're focusing on rural health as part of our program. What is the hospital doing now to help advance the health of the area's rural population? And what are you doing? What are you thinking about in terms of going forward and doing even better? And particularly with regard to Epic and the electronic health record. And keep in mind that not everybody understands how this works. So want to keep it simple and to the point, but from what I understand, it's pretty impressive stuff.
Yeah, no, so you're spot on. And look, we applaud, your focus on this. I think it's exactly where we all need to be focused. And, I would just say thank you for, trying to depoliticize this, because it's really not about politics. Sadly, in some realms, it's become that. But it's really just about staying, patient centric and patient focused. And so I applaud the Institute and your own efforts to do this. And you've been doing this for many, many, many years, which is wonderful. And so we're in that same boat. We just focus on our patients and how can we make their access to and, understanding of healthcare better to advance their health. So we're doing a number of things. Again, most of this was started before I arrived, but it's something that gives me a great platform for us to build on. So let me talk about a couple of different efforts that are separate but related, very related to this. Aspen Valley Health has strongly leaned into value-based care and has worked to, through the Western Health Alliance and through some smaller organizations that relate to that, to establish its own version of value-based care. And that's going very well. It's an opportunity for patients to have their entire care managed in a way that is focused on keeping them well and out of higher acuity situations. For providers, and I put everyone under that, physicians, hospitals, et cetera, the economics are set up so that you're incentivized to keep people healthy. The older way, the non-value-based care way, is, essentially, and you can correct me on this, Ruth, but it's kind of designed, the more we do to you, the better the economics are for providers, hospitals, physicians. This reverses that formula to say, keep me healthy, keep me out of the hospital, keep me living a great life, and then I'll reward you economically for that. And so, that's a very kind of broad description of it, but we're very engaged in that concept and philosophy and believe that that is, the right approach. So then the question in a rural area becomes, well, how can we engage and reach those folks? And so, we are very fortunate. And again, this work preceded me, but boy, am I lucky to be able to inherit this. We are the only critical access or rural hospital in the country with whom Epic has engaged and made an Epic Connect site or a primary Epic Connect site. And what does that mean? That means that Epic typically, and I don't want to, I may misspeak, but typically Epic does not deal directly with hospitals our size. Aspen Valley Health is a 25-bed hospital, so small by numbers, right? But we still have an important impact on our community. And so Epic and Aspen Valley Health formed a relationship, again, the only one of its kind, where we are helping to inform Epic as to what really works and what is different about rural healthcare. What do our patients need from an electronic health record and all of the other support, modalities that go into, the Epic products, and there are many. What do we need that is a little different or even very different from folks living in suburban or even, denser urban areas? And that has been very helpful because now hospitals like us are coming to us saying, hey, help us sign up for Epic and we'll go through you. We honestly don't make any money from this, but it helps us scale in a way that's very effective. And I believe over time, this is going to be an incredibly important tool because we will help Epic and others develop a database, and even more importantly than a database, or equally important, a set of experiences around helping rural patients access better care, higher quality care, being able to measure in real time, where are we successful and where do we need to lean in and do something a little different?
In today's world of AI, chatbots, DIY or the do-it-yourself medical movement, wearables, home lab tests. I just read an article yesterday about now you can do your blood work at home and ship it in and they'll tell you what your problem is, as well as the major loss in trust in many of our institutions and the amount of misinformation out there. Taking all that into account, that's got to make the provision of patient-centered healthcare even more challenging than it was before. We're going to take on that challenge as part of Aspen Ideas Health. We've got an entire block of sessions dedicated to the topic of we, the patient. We're going to hear from experts in AI and health, other digital tools, the DIY movement. And we're also going to showcase patients themselves, patients who felt they weren't getting patient-centered care, that no one was paying attention to them. So they went out and created their own patient-centered care and in some cases developed actual ways to treat some very rare diseases. We're going to showcase all that. But you guys, you and your staff, you're really the boots on the ground people. We're just studying it and talking about it. You're really the boots on the ground people who are navigating this challenge, all this technology stuff, misinformation. How are you guys taking it on? How are you addressing all this and still being able to do the kind of patient-centered care that I know you and the hospital are dedicated to?
Yeah, so this is a great question. I'm thrilled, first of all, that the Institute and the Ideas Fest is focused on this, and I'm sure I'll be at as many of those talks as I can. I'm excited to hear that. And just to say, I'm a big believer that AI, said broadly, can really help cure some of the challenges, especially the logistical challenges that we face. And so that's where we're focused. And some of my experience, even before I got here, was, how can we utilize AI, again, said broadly, to connect with patients, help them get better access to the care that they need, identify the care they need, follow through, and just make the patient experience, just a more pleasing one. Because, like, honestly, and I'll just give you anecdotally, when I was living in New York, you live in New York for a long time and you lead health systems, you just start to know everybody, and that's all good. But I'll get calls from, people who, have the means to go anywhere and do anything. And they'll say, I can't get in to see this person, or I can't get, this appointment or that. Can you help me? and I'm always happy to help. But it always kind of triggers, a little circuit in my brain that says, wow, if that person is calling me to get in, think about the average person or the person who, is barely getting by. How do they get health care? And that's always stuck with me. So I transport that experience to Aspen, and I see fragmented care and challenges in getting access to care and understanding what you need and when you need it. That's overlaid by the challenges of just being in a rural area. And so I believe what we're trying to do is look at some new AI that's out there. And there are a few companies, I'm even on the board of one, but a few companies that are focused on eliminating that fragmentation and have developed kind of the interactive chat ability to really deliver. It'll never probably quite be a true human interaction, but one that is actually very close and quite pleasing to people. And then when you reach the end of the line with whatever experience, there's an opportunity to interact with a human who can help you. And so we think that if you can solve a high percentage of issues this way, that value add is you can do it very quickly and efficiently. And that is very pleasing to a patient. I'll talk to a bot if I can get to the answer really quickly and effectively. That to me is definitely worthwhile. And the experience I've had even in some other industries is it can get solved even faster that way. And when it doesn't, as long as there's a fail safe where you can say, okay, we've all been on the airlines and say, representative, right?
Yes, we have.
It's like, and sometimes you just say that right off the bat.
Absolutely.
Um,
But you would, Richard,
that's the general idea.
you
That's
would never suggest, I don't think, that there is a substitute for human interaction with a healthcare provider. I assume we don't want to. I'm not a physician, of course, but I would think we don't want to lose. There still is an art to medicine, not just the science.
100%.
And that art is much of the interaction that goes on. It's even, I know there's a lot of promise with AI and radiology, but I've had my own personal experience where someone's looking at that and just sees it a little bit differently that makes a difference in the diagnosis. So I'm assuming AI is a great tool and certainly can bring a lot of efficiency, but we never want to get rid of the
100%
interaction.
Look, 100%. I just think this is kind of natural progress, but we have to manage it. And, it accelerates. It happens and evolves faster than anything we've seen before.
Yeah.
And I think that probably correctly creates a certain level of anxiety. But I also kind of flash back to whatever it was 30 years ago, when I was just a young physician and, the idea of an electronic health record was, well, that's going to cause me to practice cookbook medicine, which I'm never going to do. Well, guess what? It's evolved, right? And now you wouldn't think of not having an electronic health record, and the groups or the providers that don't are way behind and are really challenged to deliver good care. So I just look at AI as that. It's something that's going to, when it gets done correctly with the right safeguards, which are absolutely necessary, it should and will, I believe, complement the care we give and actually do what physicians want, allow physicians to spend time with patients in a way that's the most meaningful and the best use of time so we can all practice at the top of our licenses. And I think that's what AI is ultimately going to do.
I want to turn to the question of leadership. You've got and you've had extremely rewarding and yet very tough jobs. Much harder, I think you would agree, these days, especially in the healthcare space, than I suspect it was when you were back at GW, helping to run the hospital there, certainly when I was at the School of Public Health. As the hospital's new CEO, how do you take all of that, these very challenging times, and lead the hospital towards what you've also mentioned a number of times is your ultimate goal, which is better health and better health care for all living in the Roaring Fork Valley.
No, it's a great question. I think about this often as well. So, for me, Ruth, it's never been, oh, this is a much harder time, because I always have, as long as I've been, in leadership, it always, in that moment, it always feels like, oh my
I
goodness,
guess
this
so.
is more hard. So I think I don't know that it's harder. It's just different, and the challenges are different. I would say it is a bit more complex. Yet the tools we have to solve the problems are, also in some ways, more complex and better suited to solve those issues. And so that excites me. And so when you kind of understand what the issues are and then the potential tools you have to solve them, for me, and this is a big part of leadership, is looking at an issue or a set of issues or challenges, understanding what the potentials are for solutions, and then starting to design a solution for those challenges that, ultimately end up in a vision. And then when you can come with a vision, you can actually pull a team together and get that team really excited about the vision, because once you execute on that, you come up with a result or a set of results that address the original challenge. And that's what we all want, is to kind of solve these issues so that we can have an impact and look back and say, you know what? It's not perfect.
Right.
It probably never will be,
It never
but
is.
like it's better than it was. And so on an individual level, if I can leave things better than when I inherited them, then like I'm feeling pretty good. And that's kind of the goal. So it's the same leadership philosophy that has guided me and that I've learned from great mentors over time, that I've embraced, and, try and build on that and kind of put my own fingerprints on it. So that's
Well,
exciting.
I have absolutely no doubt that you're not leaving anytime soon, that's for sure. But I have no doubt that however long your tenure is, that at the end, the people of the Valley are going to look back and say, that guy made a difference and really made things better, which I
We
have
got a
absolutely no doubt about it.
we got a
Now,
great team. So yeah.
before I let you go, I want to make a pitch about you and Aspen Valley Hospital's role in Aspen Ideas Health. I think, as you know, as part of our program, we've created a special series of 3 sessions focused on healthcare issues of great importance to the local community. With Aspen's being the place that Aspen Ideas Health and the Institute at large, we consider to be our home in so many ways. We want to have dedicated program designed specifically for the people who live and work in the Valley.
We're thrilled. We're honored and thrilled to be part of it. Thank you. We feel like we're the Institute's front yard and backyard, and we're just happy to be engaged. I think that not only do we believe that we can provide some valuable insights and thoughts on rural healthcare, but we also we want our community to really understand what we do and how we do it, and like Aspen AVH. Aspen Valley Health is a real gem, and this is just an opportunity to show it off. So thank you again
Well,
for
that's great.
engaging with us. And
we're excited, and I want to thank you for a terrific conversation today. We look forward, of course, to seeing you, I hope, across the 3 days at Aspen Ideas Health, and to working with you on these sessions that we're putting together. But beyond that, our intention, and I hope yours is as well, to build this partnership so that we're doing a lot of stuff together throughout the year, not just in June. And we very much look forward to that. And I will just close by saying, you're going to hear this a lot as you talk to people at the Aspen Institute. As we say, we very much look forward to continuing the conversation. So thanks again for everything.
Thank you, Ruth. The feeling's mutual. I really appreciate it.